Hello, everyone, and welcome to today's SOAR webinar on housing access and stability with SOAR. Today's webinar is presented by the SAMHSA SOAR Technical Assistance Center at Policy Research Associates under contract to the Substance Abuse and Mental Health Services Administration of the U.S. Department of Health and Human Services. My name is Pam Hine, Senior Project Associate here at the TA Center, and I'll be your moderator this afternoon. Before we officially begin, a few housekeeping tips out of the way before we begin. So your lines will be muted throughout the webinar. This webinar is being recorded and will be available for download on the SOAR website in about a week. Right now, you may download the PowerPoint slides. You have two options. First, if you look to the top left of your screen, you will click the icon File, hit the Save button and the document to download the material. Your second option is to visit the SOAR website, and the link is provided on this slide. So on the left, once you get to the website, on the left side, click Webinar, find today's topic, and the PowerPoint slides and our new housing issue brief are ready to download and print. At the conclusion of the webinar, you will be asked to complete an evaluation. We value and appreciate your feedback and use it to improve and inform future SOAR webinars and activities. So please take a few moments to complete. We thank you in advance. Now, a quick review of the agenda. You'll be welcomed by Kristen Lutfer, SOAR TA Center Project Director, followed by Abigail Lemon, Project Associate here at the SOAR TA Center, who authored the issue brief. Next, we'll hear from Peter Pike from Denver, SOAR State Lead, Bilky Rock, SOAR Coordinator in Baltimore, and Will Connolly in Nashville, formerly with the SOAR TA Center. So welcome back, Will. So let's briefly discuss and review our learning objectives. By the end of the webinar, you should have a better understanding of SOAR and its connection to housing access and stability by hearing from 3 communities which have successfully linked individuals experiencing or at risk of homelessness using the SOAR model. Now I'd like to present Kristen Lutfer, our Project Director, who will give our welcome this afternoon. Kristen?
Pam, and welcome everyone. We were excited to see nearly record-breaking registration for today's webinar. Over 1,200 people registered for today's event, and we can see that already over 560 have joined, and we know that number will go up in the next 5 minutes or so. And I'm sure that we're receiving so much interest because SOAR is not just about getting that check. Access to the income from SSI and SSDI and the health insurance from Medicaid and Medicare is only getting. Our ultimate goal is to help end homelessness and promote recovery. And we can do that without housing. And we can do that without creative strategies to make small monthly incomes cover large monthly rents. Hear from presenters today who will share how they are transforming their systems to better serve individuals who are benefiting from SOAR in their communities. You'll hear how new partnerships and funding opportunities have influenced key paradigm shifts in Colorado. You'll learn how an unfortunate equation in Baltimore led to a new Housing First initiative that is working fantastically. And finally, you'll hear how Nashville is revisioning their system in an emergency room. There's a lot to learn today, so without further ado, let's continue with our first question.
So to ask you a poll question, we know that having an income makes it easier to secure housing, and the income a SOAR applicant receives from SSI and SSDI helps to achieve this goal. So we want to know, have you seen SOAR work like this in your community? So yes, no, or unsure. We'll just give a minute to take some time to answer. Well, thank you for participating. It looks like 158 folks have seen the benefits of using the SOAR model to assisting your SOAR applicants with accessing housing. So that's wonderful. That's really good news. And for folks that aren't quite sure, look into your programs. See if you're able to follow along with the SOAR beneficiary to see if housing has been accessed. So we appreciate you taking the time. It just further clarifies just that SOAR does work. Okay, so now I'd like to hand the mic over to Abby, who will introduce us to the new issue brief.
Thanks, Pam. The SOAR TA Center recently released their latest issue brief entitled Housing Access and Stability with SOAR. The issue brief was a collaborative effort between the TA Center and leaders in the field of integrating SOAR with access to housing. The brief addresses the concern that is experienced in communities large and small across the country, that without access to stable income, maintaining and accessing safe and affordable housing is very challenging. And what we know is that individuals who are experiencing or at risk of homelessness, for individuals who are experiencing or at risk of homelessness, a stable place can be a crucial step on the road to recovery. The issue brief highlights the efforts that are occurring in Nashville, Tennessee, Portland, Oregon, Denver, Colorado to connect SOAR and housing. But it also goes beyond the statistics and shares the stories of actual people who benefited from these collaborations. The SOAR TA Center is excited to introduce this issue brief, as well as the speakers on the webinar who will be sharing their expertise and examples of how their work has impacted their communities.
So much, Abby. I appreciate the hard work you and the other collaborators put in to this most exciting issue brief. Without further ado, I'd like to introduce our first presenter, Peter Pike from Colorado. Peter?
Good afternoon, everybody. Thank you for the opportunity to be part of the webinar today. I'm joining the webinar from Colorado. My name is Peter Pike, and I serve as the Executive Director of a nonprofit agency called the Colorado Disability Benefits Support Program. We're a statewide agency in Colorado, and we were established to provide direct SSI, SSDI application assistance and deliver technical assistance for organizations interested in this service. And of course, we follow the SOAR intervention. And as Colorado DBS is what we're known locally as, we also serve as the SOAR state lead agency. And we only nonprofit agency in the state that's solely dedicated to delivering the SSI, SSDI application assistance. So we appreciate the opportunity to participate in this topic and are appreciative of all the folks that are spending the time to join us today. Talk a little bit about how we've gotten the funding to really join in this model of supporting housing first and using the SOAR intervention as part of that. We actually partnered with the Colorado Office of Behavioral Health, which is with the Colorado Department of Human Services, back in the spring of 2013. And at the time, they were applying for federal funds through the Substance Abuse Mental Health Services Administration, known as CABI, or the Cooperative Agreement to Benefit Homeless Individuals. So the coalition of partners that came together at the time was the Department of Human Services Office of Behavioral Health. It was partnered with Mind Springs Health, serving the Western Slope in Colorado, as well as the Colorado Coalition for the Homeless, continuum of care agencies, and a number of advocates. And we came together to look at how can we effectively serve the needs of individuals experiencing chronic homelessness. Through this partnership, we were able to apply for funds through the Substance Abuse Mental Health Services Administration and Office of Behavioral Health, secured those funds in all of 2013. So we've actually been using this model for a couple of years now. Quickly on this call, what I wanted to highlight is the partnership we have with the Office of Behavioral Health, who is a behavioral health organization statewide. and receive funding through Substance Abuse Mental Health Services Administration, or a Coalition for the Homeless, which is a leader in serving individuals experiencing homelessness. Of course, our agency, DBS, that's the SOAR State Lead Agency. Each agency that I'm referencing all sort of have a role in looking at how do we support veterans and individuals experiencing chronic homelessness in being housed. And so it all kind of starts with the Office of Behavioral Health, who received funding, created contracts with the Colorado Coalition for the Homeless. And the role in the project is to implement the Housing First model, and specifically so use a tool, VOUCHERS for that. And that tool helps identify individuals who are recommended for housing and support interventions based on the score and those with the greatest need, specifically into this program. It's going to get the Housing First supports, the wraparound services, and the access to treatment and services that they need. This organization, the Colorado Disability Benefits Support Program, we're primarily responsible for the intervention. So we contract with the Office of Behavioral Health to train and hire certified practitioners. In this regard, as the Colorado Coalition for the Homeless is conducting their role and their work in working with folks experiencing chronic homelessness, we come into play where we provide the access to SSI, SSDI, develop the using the SOAR model. So in order to implement this using Housing First combined with SOAR, I'd like to be able to tell you, oh, it's very simple and it happened overnight. But there's been quite a bit of coordination that's been required to implement this. And so coordination in a number of ways. It happens through face-to-face meetings with the Office of Behavioral Health, with the Colorado Coalition for the Homeless, with our team, our SOAR practitioners. We want to get everybody comfortable understanding our roles. As we work and learn each other's roles, then it becomes easier to see how we fit in and coordinate this effort. So the idea essentially is, as folks are housing vouchers and getting placed in housing, that they're also able to acquire Social Security disability benefits so they have income to support housing stability. So we coordinate this effort by our staff, our SOAR practitioners being co-housed at the Colorado Coalition for the Homeless, so that when there are referrals that are needing SSI, SSDI application assistance, we're on site and we're able to do initial meetings there. The Colorado Coalition case managers are working with folks directly. They can do a warm handoff to our SOAR practitioners and build that relationship in that of time as our SOAR practitioners are introduced to folks, don't just hold office meetings, but as we identify their need for SSI application assistance, we're able to meet those individuals where they're at. That be in the community, it may be a location of that individual's choice. The idea is to make sure that we're delivering these services where folks can successfully receive them. You'll take a look at language barriers, cultural barriers, other barriers that may come into play, because we understand that this is for everybody and not just for a certain segment of the population. And so as a result, We looked at using bilingual staff, at bringing interpreter services, that sort of thing, with the aim ultimately being supporting these folks and accessing housing and then acquiring the income they need to build on that housing stability. And so it's really this partnership that we've been able to form over the couple of years that has resulted in folks successfully being housed and increasing their stability through SSI, SSI benefit programs. One that learned by doing this model is this is definitely a paradigm shift. And so that orientation and meeting with the Office of Behavioral Health, with Colorado Coalition for the Homeless, with the practitioner, we want to make sure everybody's on the same page. And one of the elements that we talk about, particularly with those applying for SSI, SSDI, is we never want to discourage the employment option. Then inquiring SSI, SSDI, there's nowhere that says when you're applying for the benefits, you quit working. In fact, I think what we learned through implementing the SOAR intervention is that we want to encourage folks to work, because the bottom line is work is a criteria that Social Security Administration looks at. So for our model, we're using the Housing First model. We've got the Colorado Coalition, who's using the Vulnerability Index or the VI-SPDAT tool to identify those with the highest need. For housing support services, we're implementing the SOAR model, certified practitioners. Seeing success, on average, people are getting approved for SSI within about 85 days. And want to discourage individuals who for SSI, SSDI, if they want to work, to gain employment. And we encourage that from the beginning when we're developing applications, and we're also letting folks understand and know once they receive SSI, SSDI, there are work incentive programs available to folks that allow them to go to work while continuing to maximize their SSI, SSDI benefits. That model that we're doing here in Denver, Colorado, we're very appreciative of the efforts of our partners in this initiative. We're appreciative of the funding that comes from the Substance Abuse Mental Health Services Administration. And at this point, I'm going to hand this back over to Pam.
Thank you so much, Peter, for sharing the success of your Housing First and SOAR program and linking the two together. Just wonderful to hear. Tony would like to go to our second and final poll question. I'll gauge your listening skills with Peter. Peter identified a few paradigm shifts. Can you, multiple choice, figure out which of these were paradigms that Peter mentioned in his presentation? We'll give you a minute to do that. See that the vast majority of you could E, all of the above. All of these are paradigm shifts which Peter has been seeing in his community. So thanks again for participating. We do appreciate it. So our next presenter, I will introduce you to Bilky Roth from Baltimore, who will discuss her SOAR program. Bilky?
Thank you, Pam. So delighted to be here today and to have a chance to share a bit about the SOAR initiative and the Housing Pilot Program in Baltimore. I think this is a familiar face to many of you. It's straight from a training video from the original Stepping Stones to Recovery SOAR training. And I include it because I'd like to just give a brief background on SOAR in Baltimore to set the stage for how our current housing program developed. And as many of you know, Yvonne Brett began implementing SSI SSDI assistance in Baltimore in 1993 through an SSA demonstration project. In the Behavioral Health Administration of the Maryland Department of Health and Mental Hygiene is our SOAR State Technical Assistance Team and State Planning Work Group. And in Behavioral Health Administration awarded past funding to Healthcare for the Homeless in Baltimore City to establish a SOAR local lead. Healthcare for the Homeless is a federally qualified health center, and we provide comprehensive medical and behavioral health services to over 10,000 people every year. And with four psychiatrists on staff and more than 20 therapists, an outreach team, a supportive housing program, SOAR fit in really well. So in 2009, the local lead further developed SOAR trainings, relationships, and systems. And again, working with the SOAR state team at the Behavioral Health Administration, we were able to demonstrate the need for a SOAR dedicated provider in 2010. And in 2010, a past-funded SOAR dedicated outreach specialist was on board to those individuals who are hard to find, build relationships with them, and complete applications. Also, the Behavioral Health Administration leveraged new funding and created 5 new SOAR dedicated positions across the state, including one in Baltimore to focus on working with veterans. And since 2009, as it says, the SAMHSA SOAR team has assisted over 400 people with a 9% approval rate. So now this is the view from HCH's front porch, and that white dome is Baltimore City Hall. So just the success the program was seeing in getting people SSI and SSDI, our clients were often still living in the shelter down the street or in desirable doubled-up living arrangements, and yes, sometimes in tents across the street from our clinic. Equation. With them and without affordable housing, it's nearly impossible to help someone come out of homelessness. And through SOAR, at this point, getting eligible people approved for benefits almost seemed like the easy part. Getting had been the harder challenge to tackle. And then there's no SSI supplement, so although some are eligible for SSI and SSDI, most of our SOAR clients are receiving only SSI, so their only income's that federal benefit rate of $733 per month. As it says, the fair market rate in Baltimore for just a studio is $833 per month. One bedroom is $985. So a recipient's only option is to continue living in those subpar living arrangements while waiting through the months or the years of paperwork and wait lists for a voucher, a subsidy unit, or public housing. So we were in conversations about this issue. Over the next 2 years, the Maryland SOAR Technical Assistance Team at the Behavioral Health Administration and the Homeless Policy Team by potential resources and discuss how we could leverage them to house individuals who have a history of homelessness and mental illness. The Homeless Policy Team put forth a proposal to provide rental assistance to people out of state hospitals and prove for benefits through SOAR. The funding identified to address this need came from the Maryland Community Services Trust Fund, which was to hold proceeds from the sale and long-term lease of facilities previously operated by the Behavioral Health Administration. There was money available because the state was selling and leasing the building that had been the state psych hospitals. To determine where to pilot this housing program, the state did a needs assessment based on homelessness data and also took into consideration the social service infrastructure existed to support the program. The aim was to demonstrate the cost effectiveness of parental assistance to individuals at risk of needing care in an institution. So the eligibility criteria was up to include these populations. In order to receive assistance from the program, the individual must meet one of these 3 criteria. One who is approved for SSI or SSDI through SOAR, someone exiting a state psychiatric hospital or something a residential rehabilitation program. So both a cost prevention component and a cost reduction component to this program. Those benefits through SOAR are being provided housing assistance as a measure to prevent them from needing a higher level of care. For assistance upon exit from the state psychiatric hospital or residential rehab program, or stepping down from that higher intensity of services to live in the community when it's inappropriate for them to do so. In late 2014, the state put a request for proposals for this program. In 2015, the Behavioral Health Administration awarded funding for the Housing First program to two organizations, us, Care for the Homeless in Baltimore City, and another agency, People Encouraging People, who are operating the program in Montgomery County and Prince George's counties outside of Washington, D.C. Awarded 36 housing slots. There was also funding for 2 peer advocates and an additional SOAR dedicated outreach position. That dedicated position works exclusively with people leaving the state psychiatric hospitals to ensure they're receiving disability benefits upon release. Once a client's referred, the team, including our peer advocate Nathan here, who's standing with Thurgood Marshall in front of the Maryland State House, helps the client to locate an available one-bedroom unit for under the Baltimore one-bedroom fair market rate of $985 per month. Clients contribute a third of their total income towards rent and utilities. Healthcare for the Homeless uses the state funding to cover the rest. It's successful because it's operated within Healthcare for the Homeless's larger scattered site supportive housing program. They're really the superheroes of this program. They support the housed individuals in a variety of ways, like helping people get furniture, find resources to pay down back gas and electric bills, helping people get identification, and ensuring that they're connected to necessary medical and behavioral health services. And if an apartment doesn't work out, they assist with finding and relocating to another apartment. Don't view that as not a success. We view that as a need for relocation. So the first SOAR housing client was settled into their apartment in April last year. And since then, we've housed 25 people and raised about 5 more in the referral and leasing process. Because the program funded by the state of Maryland, we've been able to house extremely vulnerable individuals within weeks of being referred. All of these clients aren't eligible for other housing programs because of their criminal history or because they can't provide the documentation needed to meet the strict definition of chronic homelessness required by HUD. Additionally, some were not successful with completing their voucher application processes. Sometimes their mental health symptoms prevented them from being able to engage in care. So I'll speak briefly about one person who was housed through this program. She's engaged at Healthcare for the Homeless for 4 years. There's from some pretty severe delusions that she's being followed and targeted, and she pretty much always feels unsafe. And 2 occasions, 2 years ago, she went through the Housing Authority voucher process application, and at times was matched with a voucher, but ended up losing it before she got into housing. Both times, she'd been prioritized as highly vulnerable. On the first round, she had fears about providing a birth certificate to the Housing Authority and refused to do so, so she turned voucher. And the second time, she got further in the process, but right before the apartment was going to be inspected, her provider was out sick, and she had a meltdown and took it as a sign that she should take the apartment. So last year, after being referred to this Housing First initiative, she moved to her apartment within 2 months and has been there since last May, and she's stably engaged in medical and mental health treatment, and last fall she took classes at the local community college. Again, because the program is state-funded, extremely low barrier, and people have not been successfully housed any other way, have been housed and stayed housed through this program. It's a 3-year grant, and we're in the 2nd year, and part of the conversation from the beginning with the state was that we're not in the business of housing people to then take away that support and have them be back in the shelters and on a waiting list. So the state has sure to take measures to ensure that the program will be sustained. I'm sharing this picture. It makes everybody happy. If you're ever in downtown Baltimore, you'll be able to find Healthcare for the Homeless just by looking for a mural. And as I mentioned earlier, this housing program came to be the Maryland Behavioral Health Administration is really strongly invested in SOAR and in supporting people with severe mental illness. And it also wouldn't have happened without really good advocacy efforts to identify this need and promote it, the need for housing assistance to people living SSI and SSDI. We hope this program can continue to grow and continue to serve as a model for others. And in trying to tackle homelessness, we often are siloed sometimes into income subcommittees and housing subcommittees. As the issue brief and some other folks have mentioned, the link between housing and income is really quite crucial. So I'm really glad that we're having this conversation today, and I look forward to hearing more about these efforts moving forward. Thanks.
Hey, so thanks so much, Bilky. That slide made me really happy, and that whole presentation was just, yeah, so cool. So I look forward to learning more about what you guys are doing. My name is Will Conley. I'm the director of the Metropolitan Homelessness Commission, Nashville, and just want to thank Pam, Kristen, and Abby, and Susie, and others at the SOAR TA Center for including us in this. So I am a SOAR lover, and as all SOAR lovers know, language is really important. You know, SOAR training that you guys, or many of you guys, have been through, emphasizes using person-first language and treating people with respect and compassion. And the SOAR TA Center really trailblazed with all of that. And in Nashville, we're trying to kind of change the language that we use, and we're trying to change the definition of our field and just how we talk about our field through the lens of this phrase called the Housing Crisis Resolution System, which many of you guys may be familiar with, but it's very new to us. And I give a shout out to a group called Focus Strategies that work out of California, who promote this type of system and work with communities to try to build housing crisis resolution systems. So in Nashville, we're no longer, at least in my office, referring to the quote-unquote homelessness system or the homeless system. Instead, we're now creating or co-creating and improving on this quote-unquote housing crisis resolution system. And that's a mouthful to say, but so is SOAR, when you unpack it, when you unpack that acronym. And every word counts, in the acronym, just like SOAR. So housing crisis resolution system, it means that partnering with people who are experiencing a housing crisis, and we're trying to resolve that housing crisis as quickly as possible. So as you see on the slide, it says, the sole mission is to rehouse folks and do it really quickly and with a reasonable expectation that they can remain housed. Other definitions of a housing crisis resolution system are that people no longer have to experience homelessness for more than 30 days. So, that can kind of blow your mind in some communities, but that's the 30 days is what we're all striving toward in Nashville. So this is really a wholesale regioning of what we're trying to accomplish and really how we measure the impact of our day-to-day work. And in a sense, we're kind of an emergency room, like our system can be like revisioned as this emergency department, and frontline staff are kind of like emergency room doctors who are there to like stop the crisis, this housing crisis, from getting worse, and to save lives and to get people back to the lives that they were living before they came into the homelessness system. So this picture that you guys are seeing now is just trying to convey that sense of urgency that we feel in our work, and when we respond to the crisis of homelessness. And we're like triaging and trying to get back people back to housing. And once crisis is over, that's when like other systems come into play that help people improve on their long-term well-being. So, for example, like implant systems or education systems or behavioral health systems can then kind of come in, almost like, if we're going to continue this medical metaphor, like those systems would be almost like general practitioners. But already left our care. They've left the emergency room, and now these other doctors and professionals are assisting, and we are then freed up to go and work with other folks who are in housing crises. So that's the lens that we're kind of working through now in Nashville, and this slide is like total Brady Bunch slide. So that's what I thought about when I put it together. But so like in the past few years, we've developed SOAR housing partnerships that reflect that sense of urgency, and really try to provide housing as quickly as possible. And the first housing partnership I'm going to describe here, I kind of refer to as like a bridge rental assistance program, even though it's not transitional housing, it's actually permanent housing. And it involves a SOAR team, which is represented on the left here by Kayla Wilson. Ashley Blum is actually pictured there as well. And Kayla is the lead of a team at Park Center, which is a mental health organization, and they've been receiving funds from the city since 2006 to provide full-time SOAR staff that are really laser focused on helping people who have usually the most difficulty getting into housing, and working with them on getting their SOAR benefits. Those funds actually come through my office. On the right, the actual housing provider is called Urban Housing Solutions, and they manage a little over 1,000 units in Nashville, and they're part of a continuum of care and receive, that HUD funding. And they have about 300 to 400 deeply subsidized units, permanent housing units, and then they have about 700 or so that are, that are like well below fair market rent and affordable. So, so just quickly, one is, there's like an 8-step process that goes from top to bottom here. So just, the Park Center team, they engage folks who are out on the street, and then they use a common assessment tool like the VSPDAT in many communities. The SOAR process begins, and then housing applications are completed out in the field. So there's no need to go to the housing authority or to go to urban housing, to apply. The SOAR specialist can do that out in the field as well. Urban then provides rental assistance before the SSI or SSDI application is approved, and so they basically let someone go ahead and move into housing, and they start providing rental assistance through the continuum of care funds while the applicant is waiting for their determination to be made by SSA and DDS. If the applicant is approved, which is what usually happens because Partner has a really high success rate on SOAR applications, then it starts paying rent and like 30% of their income on rent. So that works. Adam, who's on the top right there, he's the guy who actually receives the housing applications at Urban Housing, and is just like, critical in the whole process. And he's actually quoted the housing brief that Abby and mentioned earlier. One other housing ownership involves our housing authority, and we engaged our housing authority about 3 years ago with a proposal. We asked them to make available up to 18 Section 8 vouchers per month, and give a preference to people who score really high on the VI SPDAT or other common assessment tool that other communities are using. So they actually did that after quite a few meetings. They agreed to prioritize up to 18 Section 8 vouchers a month. And so that was just really cool because, what a lot of you guys have experienced, there are vouchers out there, but a lot of times, people who are experiencing homelessness don't even get a wait list for those vouchers. So this created a clear pathway to up to 18 vouchers a month for people who have the highest needs and who are living on the streets and in shelter. So just like the last housing example, the SOAR staff around the city are kind of the hub for those housing applications as well, and they work with my team to submit those applications to the housing authority, and then once a month at least, the housing authority issues vouchers, and then we work on finding landlords for those folks. Lastly, I just kind of wanted to mention, I saw this picture. It really moved me, and there's so much good work going around the country on Housing First and what Bilky just mentioned, and the myth just keeps coming up that people who are experiencing homelessness or people who are having a housing crisis aren't motivated and don't want housing, and so in the SOAR housing brief that Pam and Abby mentioned, and that's available on the website, the vignettes that we wrote included for Nashville tried to kind of get at this idea and tried to bust this myth that people aren't motivated or don't want housing. So this picture just moved me, and it reminded me of this guy that I pass almost every morning on my way to work. And when I saw this picture, I realized that I rarely read the signs that people flying when they're on the street corner asking for money. And this it reminds me of how much we assume about people, or how much we don't know about folks. And so this picture is actually of a gentleman who is very motivated, and so much so that he earned a graduate degree. But he experienced a housing crisis back in the day, and he got stuck. And that prolonged experience of homelessness just really wore him down and ground him down to a version of himself that looks like someone who maybe isn't interested or is unmotivated. And so this working with urgency is so important, and it just underscores to me how much hope this work can give to people. in that getting approved for disability in a matter of weeks instead of months or years can really empower people to see that they are, in fact, deserving of good things, and that more good things will happen to them or happen to them in the future. So that for me. Thank you.
Well, thank you so much, and also for sharing the personal stories of some folks in Nashville and how you've been able to use Housing First to link them to affordable housing in Nashville. We do appreciate it. And as you'll see for all of our presenters, we do have contact information slides. Should you want to reach out to our presenters personally, please do so. They'd be more than happy to answer any further questions that you may have. So we have plenty of time for Q&A. So a couple of ways you can ask a question. You can type your question into the Q&A panel located underneath the participant tab, or to ask a question by phone, please raise your hand by clicking the hand icon in the participant pod. We will unmute you so you can ask your question. The question that came in from Vermont, we had a question come in, and it's a general question that I think any of the presenters may be able to ask. It's about buy-in, particularly around Housing First. And the question was around the aging out youth population. So just wanted to ask, throw it out to everyone, how did you achieve buy-in from your town or city? What was it that really hit them and they were able to see the benefits of Housing First? I'm going to unmute all of them. Okay. And all presenters are unmuted, so I'm not sure who would like to take that first. I know Will presented how he was able to reach out to the community, powers that be. Will, you want to talk a little bit about how you were able to get buy-in?
Sure, yeah. One thing we did was we went to other, the goal is to engage our public housing authority, and one of the examples that I talked about. So we went and talked to other housing authorities that had done things that we wanted to do in Nashville, and we engaged those staff who really took ownership of implementing Housing First, or implementing a more progressive type of housing, and really got them to help us engage our local housing authority. So that was one strategy that really worked, and we got some help mostly from the West Coast, but also the Midwest and all over the country in terms of examples of innovative things that are happening in housing authorities. We also we got a local landlord to really buy into the model, and he was able to talk to other professionals and landlords about Housing First and why he believed in it. So it was less of me as a social service provider or planner or policy person, and instead we tried to find allies who were in other parts of the system to help us kind of do some peer-to-peer like that, if that makes sense.
Gil, thanks. I think many of our participants listening will engage their housing authority and some other organizations too. Appreciate your insight. We have a question that came in. The question is, how can one encourage a consumer to accept affordable housing when they have been so used to living on the streets? And I think that this could go to all of our presenters out there. Bilky, would you like to take that one?
Absolutely.
Okay.
Yeah, this is something that definitely comes up we have been struggling with some of our folks who have such severe mental health conditions that is a barrier. What we can do in that kind of situation is just continue to provide the service, and that's when it's most crucial that the services we're providing are as low barrier as possible, because that's something that the individual and that the system can't help. That's something that we have to work with that individual to try to work through to get them into housing, if that's possible for them. But wisdom and with our agencies and with our government administrations have to work through the barriers that exist that are beyond that person, so that we can work with that individual person on that issue, and have to work through the bureaucratic structures and have that be the barrier.
Bilky Fad. Does anyone else want to add? Because I know this is probably a very expected response to folks who are now being introduced to housing. Want to add?
Peter, now I'll give Peter a chance to get.
Okay, Peter, have you experienced this yourself with those you serve?
Yeah, this is Will, and I don't have much to add to Bill's great response there. Just like continuing to engage folks and try to walk with them through what can be like a really tough, transition. And like Bilky talked about, like there are times when people will housing a shot, and then they might fall out, and then we'll keep, working with them to try to find something else that may work better, that may be in a neighborhood that they like better, or always try to keep have some sort of choice in the process. So yeah, that's
an answer.
Hi, Pam. This is Peter, and I was just looking for clarification for you to repeat the question, and then I'm happy to.
What kind of strategies do you use to help a consumer who has been living on the streets for so many years and may be fearful or reluctant to accept housing for the first time in a long time? How do you help the consumer accept the housing?
Yeah, I think that's a terrific question, and I think there's no one answer to that question, quite honestly. The model that we presented, it's the Colorado Coalition for the Homeless that's really working with individuals around the housing piece. And so, we look at that person-centered approach, which is, understanding the person and working with the person where they're at, and to identify ways to support that individual and what their interests are. I don't think there's one specific strategy that's going to help answer that question for everybody that we're working with.
Peter, for that, yes. I think that there's so many different strategies, and offering choice and utilizing peer supports to help engage a person, into new housing. So we appreciate that. A question came in that this might be for Will. What strategies did you use to engage private market landlords to encourage these landlords to accept vulnerable tenants?
Yeah. Well, we first reached out to. We got a landlord on board pretty early on, and he agreed to get on one of our boards, basically a subcommittee. And so we just started meeting with a local landlord who really believed in the process, and so in housing first and other interventions. So I know not every community can find a champion like that, but we were able to, and so he helped us just understand how to talk to other landlords and like understand that language because we weren't very good at it. We didn't know the vocabulary. Just like if someone came into our, homelessness meetings and tried to understand all the acronyms, there are similar challenges when you speak to housing professionals. So he kind of, but now I have someone on my staff who meets with that landlord every week to go over a strategy of how to not only find new landlords, but to maintain the cadre of landlords that we currently have and to retain them. We also did some practical things, like we created a flexible pot of money that we use to pay for move-in costs, or on the rare occasion that there are damages to the apartment, we can pay for those. I think that's. I'm trying to think of some more ways. In a few weeks, we're holding a community training on landlord recruitment and landlord retention, and we actually got lucky enough to bring in Ian DeJong, who created the VI SPDAT, and so we're just trying to continue to have these conversations of how to get better at recruiting landlords. We don't think we've hit, the limits of outreach. We still think we can improve and reach more. Yeah.
Thanks, Will. I think the takeaway is to find those landlord champions and engage them and get them involved in your initiative, show the positive results to a community when an individual is indeed housed. So we have a question from Leonard Brown, who is on the line, and we're going to unmute your line so you can ask your question, Leonard. Leonard, are you on the line? It looks like Leonard may have left the line, but certainly you can ask the question through the Q&A function, and we'll get that answered for you. Okay, we have Arthur Rhodes, who has their hand up, so we'll unmute your line and take your question. Yes, we do.
And is, in regard to the particular programs, are there any collaborations that have been made with correctional facilities or local correctional facilities within the area in regard to helping the homeless or helping the returning citizen as well? Are there safeguards in place in regard to those homeless that are housed to reduce recidivism?
Yeah, that's a great question. We do have an initiative within the SOAR program here at the TA Center for justice-involved individuals. So we can connect you to Dazra Ware, our subject matter expert in that area. So we can certainly offline give you her information if you'd like to email the SOAR TA Center. But I know that Will's program, Park Center, does have an amazing program with the Department of Corrections. So, Will, do you want to just discuss very briefly, how you've been able to engage prisoner reentry and work within that system?
Sure. Yeah, we still have a lot to do and improve on, but Park Center's team, they do some in-reach into the jail here in Nashville. And then, I guess about a year and a half ago, we wrote a proposal, going mayor, to fund at least, I think it was actually 3 funds to do SOAR in the jail. Actually, these are folks that work for the jail. They're not doing in-reach. They're actual sheriff's department employees, and so we now have SOAR specialists working in that system, which is such a difficult system to work in. We're still, working out the kinks there, and still trying to figure out the impact on recidivism. But we hope that connecting people to SOAR before they are released and connecting them to income and insurance, of course, will help reduce recidivism for the folks.
Thanks for that, Elisha. So we have had many questions come in about helping individuals once they receive housing and utilizing their SSI or SSDI income to support their housing. What other supportive services or other income programs that might be out there to help individuals maintain their housing over time, in addition to the SSI, SSDI income? And I'll just throw that out to, all of the presenters. How do you help folks maintain their housing over time?
This is Bilkis, and I will jump in and say that as part of our SOAR process, we do, urge and remind folks that just meaning engagement in services in general will be the best thing to be able to, maintain their benefits and maintain their housing. And with that, part of the application process and engagement process is that isn't just a let's get your benefits and then we're done. It's a let's get your benefits and then we'll continue the process.
The other speakers have anything to add on support services make available to folks that are, in housing, in services, or even to maintain housing?
Colorado, and so Colorado recently received another CABI grant. It's called CABI Enhancement. CABI stands for the Cooperative Agreement to Benefit Homeless Individuals. As folks are receiving SSI, SSDI, the elements that's being looked at is a nation of what they call the IPS model, individual placement and support model. It's a model for supporting individuals with mental illness to get into the workforce. And so we're looking at employment options for folks to really build on their economic self-sufficiency. And I think combined with that is just sort of putting people to work, but helping them make informed choices so that as folks are receiving Social Security disability benefits and they're getting earned income, not only are they looking and understanding the impact on SSI, SSDI, they're also looking at other public assistance programs that they're on, like housing programs. What is the effect on earned income? And so our aim as we look at implementing this with the CABI Enhancement Program is to understand how employment may be an option. We're not talking about necessarily folks going to work at 3 hours a week, but if folks are able to get back to work even 5 hours a week, things like that, looking at how that can help build stability without the risk of losing their existing benefits and helping people be informed as they make those choices.
Peter, I have a question for Will. How was your organization able to convince the Housing Authority in Nashville to issue 18 vouchers for Section 8 to those who were on the waiting list? And they're assuming here that it's the wait list and Section 8 is frozen, if it is indeed frozen in your area?
Yeah, it is. So these vouchers, they're not new vouchers that come available every month. So they're vouchers that normally that turn over, quote unquote. So people who have fallen out of the voucher program because they have passed away or because they are no longer eligible for voucher because of their income or because they broke a rule or something else. So instead of those vouchers, people who aren't experiencing homelessness, we, convinced the Housing Authority to dedicate those to folks who are literally homeless. And and those candidates for those vouchers, they still go on the wait list, but they move through the wait list faster because they have more, like, they call them preference points. So the higher you score on the SPDAT, the more points you get and the faster you move through the wait list. So not only do they let us put people on basically a frozen wait list, but they also give them more points to help them move through that wait list faster and get the voucher. So yeah, like I tried to mention this earlier, like the way that we did that, our strategy was first to just reach out to a couple of communities that had done that type of preference work and prioritization work, and got some tips from them. So Houston Housing Authority, they have actually have two housing authorities, and it's a smaller one, has done a lot of innovative stuff. And then Phoenix really helped us think through what our pitch was going to be to our housing authority. And then I can't remember the community in California, but I can dig that up again. But basically, once we got that input, we put together a proposal, because any idea that's going to get, trying to get traction for it, if you have to just put it on paper for it to go anywhere with government. That's just what government policy people and budget people are used to. So putting it, in a proposal that's really clean and shows that the number of vouchers that we're asking for is like such a small percentage of the total, and then connect those housing authority employees, like in Phoenix or Houston, to our local housing authority employees to show them that it's not just an idea that we came up with, it's an idea that's working in other communities. So that helped a lot too.
So much, Will, for those tips. So we have a caller, John Taylor. So unmute your line so you can ask your question. John, go ahead.
Yeah.
Are you on the line?
Okay, thank you.
All right, well, we have a few questions that came in along the lines of, so you have an individual who has a pending application with SSA using the SOAR model, but they were denied and will likely not be eligible for disability benefits, but they're in housing, through Housing First. What kind of services, what do you do to help that individual obtain the income, if needed, to stay in that particular housing, or you need to relocate the individual? So I'd like to take that question for those individuals who are not successful with their disability application. Or have all your SOAR applicants been successful and receiving SSA benefits?
Hi, this is Peter in Colorado. Just in terms of responding to that question, actually, again, our organization, what we do is we have the SOAR certified practitioners, and so that is the one service that we deliver. I wish I could tell you that 100% of our applicants went and received SI and SSDI. But essentially, when that doesn't occur, we offer a number of options to folks in terms of, first of all, getting something called the disability determination explanation, disability determination services, so people understand the reasons that they're denied and they're not just looking at sort of the generic letter they receive from Security Administration. Helping them understand the reasons for denial is a step that we take. In some cases, that may lead someone to move on and go through the appeals process. In time, we also work collaboratively with our partners in the community, meaning the Colorado Division of Housing, some of the our partners like the Colorado Coalition for the Homeless, Supportive Services for Veterans and their families, and we really try and help link people to those folks that are focused on housing to help them understand what services they may qualify in the arena. My apologies, I don't really have a good answer to the question, but those are, yeah.
Sorry, this is Bilkis. I will jump in to say that, so our program is not a purely 100% Housing First program because we do have that requirement to have disability benefits prior to being housed. And as an agency across the board for our supportive housing programs, we are very cautious and careful about placing somebody into housing because we are in this unfortunate reality that it's very difficult to maintain housing in Baltimore and, you know, without steady income. When we do end up in that situation, we really just do everything that we can to assist the person through their appeals process, you know, support them in trying to obtain part-time employment, and just support them however, you know, as much as possible.
Everyone, you know, for providing, you know, how you do, you know, respond to some of those issues that unfortunately do come up. So we do have another phone caller with a question, Kathleen Coleman, so we're going to unmute your line. So Kathleen, would you like to ask your question? It looks like Kathleen may not be able to hear us or be on the line, so unfortunately, let's see. I have some more questions that have come in. Okay. We have some questions that have come in about follow-up services, and you all have answered these questions to some extent, but for the programs that you work for, are you able to follow up with the individual once they are relocated? The question was specifically about relocation, and I know that may be difficult if they're out of your city or even state, but do you offer follow-up services to the individual once they are housed, if possible?
So this is Keith again, and everybody who is in our supportive housing program is engaged in medical, mental health, you know, case managed care at Healthcare for the Homeless, and so, as you know, we may relocate them a dozen times in Baltimore, but we stay with them as long as they're here.
Wonderful. Thanks, Bilkis, for that too. We have some questions that have come in about SOAR. Is SOAR national? And yes, it is. SOAR is in all 50 states. And if you go to our website and click on your state, you will find on the state page who the SOAR contacts are in your area and the SOAR state lead. So we encourage you to chat out to see if there is a SOAR program in your particular community. Question that has come in from Sarah. The question is, for communities matching people to housing based on the medical vulnerability or the VI-SPDAT, and to CABI outreach support to engage, document, and house based on, I guess, geographic catchment area that you're in, can you speak to how, if your community has dealt with and deal with or underfilling other CABI providers or caseloads? So if you understand that question, this might be with Peter with CABI. Have you told providers in your area?
So this is Peter in Colorado, and for our CABI program, one of the elements that we have is sort of a statewide advisory committee to that program. So on that statewide advisory committee, we have representatives from the governor's office, from the Division of Housing, vendors that are part of CABI, the Office of Behavioral Health, the Veterans Administration, and really when there are challenges that arise, we utilize that network and that advisory group to kind of help us problem solve issues that come up. One of the key partners to our statewide advisory group also is the Continuum of Cares, and in Colorado it's sure to have 3 Continuum of Cares, and so those Continuum of Cares have partners that are serving people experiencing homelessness, and so again we kind of take these challenges or these issues that come up to those groups to try and problem solve how best to get the outcome we're trying to achieve. And it's pretty specific in terms of the numbers we're trying to serve. So everybody is automatically going to qualify for CABI. Certainly for those that qualify for those services, we have a number of networks that we tap into to try and resolve any issues that come up.
Thanks, Peter, for that. There's a question that came in. If SOAR is not currently part of the, and I'm not sure if this is coordinated assessment or, part of the screening tool in your state, what are the effective ways we can advocate for this to change? So I'm assuming that in Maryland and in Colorado and in Tennessee, that there may be a statewide screening tool through the coordinated intake and assessment that's going on. Can you speak to that a little bit? That may help if SOAR is part of the assessment, has helped you to get folks, to a SOAR provider in your community.
This is Bilkis, and so we're not specifically in Baltimore part of the assessment process, but we are very engaged with all of the agencies who are conducting those assessments. And so, we have our weekly citywide outreach meetings where we are bringing up SOAR, and we're always kind of present to make sure that when those assessments are going on, SOAR is at the forefront.
Yeah, similar answer from we have weekly our employee outreach and care coordination meetings. So usually that's where the providers stay connected and get roles and leads on folks that may need SOAR assistance too.
For that, we do have a coordinated intake and assessment one-pager that I think could be very helpful, to utilize and bring to your, state or local leadership who are still working on that document. So please check it out. It is on our website. And this will be our final question. Bilky, this question came in for you. The individual, wanted to know if the person was not able to pay the 30%, towards their housing, what happens to that individual if they're not able to pay the full 30%? Or unwilling to pay the 30% toward housing? Is that you have faced?
Well, yeah, so we haven't encountered that specific issue. I mean, there's only been other challenges with engaging people and having them agree to kind of the parameters of the supportive housing program. Like with other supportive housing programs, those issues can come up. And sometimes it really does just take kind of this team of providers of wraparound care to try to work with that person to help them understand, if this person is not coming through, and what the process might be in terms of possibly if your housing not work out eventually, and so just kind of working with the person to come up with a solution around that. Again, we really we just focus on that those wraparound services and really thoroughly explaining the parameters of the program from the onset.
And well, unfortunately, this is sometimes why people out of that initial housing placement, and but even if someone doesn't get approved for disability, and they're required to pay 30%. You know, the amount that they have to pay for rent can be like really low, so that, you know, I mean, I know a guy that pays like $20 for and they're responsible for an electricity bill, but yeah, like, we, you know, make sure that folks understand the lease agreement that they sign, and that's an important thing. Like, everyone, you know, just like other renters all around the country, like, these folks sign lease agreements that clearly, you know, spells out what they're responsible for. And then if rent isn't paid, or if some other issue comes up, we encourage the landlord to contact us. We also encourage the landlord to basically treat the tenant like they would treat any of their other tenants, and issue, they're called Fort 30s, but they're just basically like written warnings to tenant, and then we use that warning as kind of an intervention or an educational kind of opportunity to talk to the tenant about how important it is to through on their end of the deal. So that helps a little bit.
Yeah, it does, Will. And knowing that you've worked a lot with landlords, a question came in from Kansas City. Has any county tried to offer landlords a tax credit for housing people experiencing credits available?
Yeah, well, we've been, I would love to offer like a local property tax credit for landlords that reduce their rent. We've been floating around that idea. You know, there have been some landlords here locally that reduce their rent, and even when a voucher isn't involved, they'll just, you know, reduce the rent from like $100 a month to or $700 or $800 a month to like $50. And that's like incredible, and it doesn't happen a lot anywhere because we have vouchers and they'll take those instead. But wouldn't it be good if we could offer, you know, a local property tax credit or something else to incentivize that type of behavior? And it's just a complicated solution that requires, you know, and state legislatures to approve, and so we haven't really made a whole lot of progress on that. But it's a good idea.
Yeah, well, at least we have something to work on for that. So speaking to some of the barriers that folks face in accessing, you know, affordable permanent housing. So this question comes in from Kim. She said that we have a lot of complexes in her county, housing complexes in her county that do background checks and have income guidelines, and this often includes low-income housing complexes. Have you experienced these roadblocks, and what have you done to break down these barriers? So maybe some of those units that require background checks.
So we have this experience in Baltimore, and really this is where the expertise of our supportive housing team comes in, with having that specific experience with landlords, and knowing, you know, which complexes and which landlords will require, you know, what type of criminal background check and what type of information, and just using that experience to place people appropriately. We don't have any legislative barriers like that, but some of the landlords do.
This will. We try to encourage landlords to adopt an alternative eligibility criteria. You know, and we actually suggest what that low barrier criteria is. And of course, we talk about how the person will be connected to services and connected to us. But that doesn't always work, of course, and sometimes it's a barrier that we can't get over, and we have to, you know, engage a different landlord. But we had some landlords adopt that alternative criteria and kind of model that alternative so that you know, can point to that landlord and say, well, he's doing it, and maybe ask, you know, for just a couple of units or one unit to get the landlord just to try it out and hope that it's a good experience for them.
Great. Another great tip, Will, and D2, and Peter, thank you so much. We are about ready to run out of time, and I first just want to say for some of you, maybe a couple of hundred of you, who were unable to access the webinar due to us reaching capacity. We just had such an overwhelming response. So I just want to just say again that the webinar will be archived on the SOAR website. And, you know, although you may have been able to hear it by phone, you were not able to, you know, follow along with the slides. So we do apologize for that. But again, thank you so much for coming out and joining this very important webinar today on housing, accessing housing. We do appreciate it. So I want to say a very big thank you to our three presenters who absolutely have utilized SOAR to nearly end homelessness in their area and help folks find safe, affordable housing. So we really want to thank you on sharing your experiences with that. And so I do want to, just as a quick reminder, just ask you to complete the online evaluation of today's webinar. It does inform future webinars, so please take the time. Also visit the SOAR website at www.soar.prainc.com and to contact the SOAR TA Center by email at soar@prainc.com. You know, we will be sure to direct any questions or comments which could not be answered today to our presenters for their responses. We will be sure to do that too. So just want to thank everyone and have a great rest of the day. Thank you very much.